Health Information Manager, Privacy Officer, Michelle Caryl. Good morning.
Morning, Bart and Andy.
Morning.
Thank you for having us.
Yes.
Thank you guys for being here. It's exciting times over at the center.
Yeah, absolutely.
It's the pharmacy is going to be open soon. The drive-through.
Yeah, actually, we are actually going to close temporarily the drive-through because we are renovating the pharmacy.
Okay.
So on the second phase, it's been into phases. So
Okay.
the second phase, because of safety, issues, we have to close the drive-through temporarily until probably end of June.
Okay.
The drive-through, it seems like you celebrated the opening of the drive-through last year.
Yeah, absolutely. And we are glad that we were able to help, our customers through the drive-through. Right now, we're close to 20% of our total sales.
That's great.
Goes through the drive-through. However, since we're gonna temporarily close the drive-through until end of June, we still can provide curbside pickup through the
nice.
Drive app. So we have some 3 spots in front of the drive-through area on the handicap section that we can provide that
So you
service.
still don't have to get out of the car. Very, very good.
Well, you couldn't, because they're moving the
there's-
pharmacy in so
Yeah.
you weren't actually have access to like the windows where the
Right.
drive-through is.
Correct. Yeah, we are expanding the pharmacy. So basically, the pharmacy is on the second phase is moving towards the center of the building, still on the first floor in front of the greater help desk. But yeah, we're going to have a renovated lobby to
Great.
help our customers.
And customers, when they're at the pharmacy, they can take advantage of discounted over-the-counter medications that they would get
absolutely.
anywhere. So that's great.
Michelle, as privacy officer, are you allowed to share any information with us today?
I am, just a little bit.
Let's talk about the health information and tell us a little bit about the functions that health information provides.
Health information, we're basically responsible for maintaining the health record for patients,
Okay.
whether that's the medical record, the dental record, behavioral health, support services. We're basically working information into the system and out of the system. So we're responsible to make sure the patient gets what they need, the provider has what they need to see the patient. So we're managing that.
You have all the information.
We do. We try.
A lot of patients, they rely on you, of course.
Yeah, they need a lot of stuff,
Yeah.
and we want to make sure we get that for them. A lot of times we're processing disability determination requests for records. We send a lot of immunization records to schools. A lot of stuff comes and goes out of the
Are you
EMR
part of
system.
MyChart?
Yes, we have MyChart.
Very good.
My department actually helps patients navigate MyChart. So whether it's resetting passwords or someone just doesn't know how to use it, we'll sit with them and work with them. and
I've
help them.
reset my password no less than 5,000 times on my chart.
Today, you know what today is? Today's password day.
It is?
And everyone should redo all their passwords.
I've used all of them.
no.
I don't know what I would come up with. Let's take a look at some photos. We've got some photos of some of the wonderful renovations. This is gorgeous. Talk us through this area.
Yeah, this is our current lobby. As today, that area gonna be closing because we're gonna close the pharmacy today at 5 p.m. Usually
Okay.
we open 8 to 7, but today we're closing at 5 to start the moving process. So we're gonna start with the new lobby starting Monday. Friday, we're gonna be closing for the public, so we're gonna give us time to move all the equipment to the new location.
How many prescriptions do you fill a day?
We are about filling, depending the day, but per week we're filling 3,000 prescriptions average.
Wow.
So it's around 600 per
Wow,
day.
that's
yeah.
significant.
Do you stand up higher than everyone?
Well, we are fortunate that we have a pharmacist counter where we
Yeah.
can see in the interactions with our patients.
That
so that's
bothers
really
you,
good.
doesn't it?
No, I love that.
Are
I
you
love
sure?
it. No, I think pharmacists should be on a pedestal.
Oh boy.
No, I think it's
I do
tradition.
like that.
it's tradition.
I do like
The
that.
pharmacy stands up on a thing.
That's right. I like
It
that.
seems like, this renovation, it seems like it got done fast. But there's a little more to do, right?
Correct. So actually, the phase 1 started on in February, and they just finished a phase 1, and today we're going to start with the phase 2.
Okay.
So we are expecting to finish everything by end of June,
Okay.
early July.
Very good. How can the communities see the upgrades? When can they see them?
Yeah, actually, we're partnering with you, with Jackson TV. So you're gonna put together a video tour for the patients,
Yeah,
so
we
they can
can't
see
wait.
all the renovations and exciting times that we are going through.
Yeah,
So.
we've been hearing nothing but great things from patients, from pharmacy guests. It's amazing all that the center offers. It's wild,
Yeah.
really.
I saw your leader last night, Bill Wypeski, at the donor wall unveiling at Henry Ford Jackson Hospital, and guess what? The Center for Family Health has a plaque on that wall.
Very nice.
So nice.
That's great.
So nice, yeah.
Yeah, we're very passionate to help our customers in the Jackson County. So
Yep.
that's
Whatever they need.
our
What can
vision.
what can the patients expect after all the upgrades are completed?
Yeah, thank you, Andy, for the question. So basically, obviously, we're going to have more space. Our currently location, we are exceeding right now our capacity. So we're going to double up our capacity of processing prescriptions. Then we're going to have the pharmacy is going to be facing customers. So we're going to have an enhanced visibility
Nice.
to our customers. So we're going to be more attentive to customer needs, consultations. We're going to have actually a private consultation room where if patient needs a private consult, we can go there, and also we can give vaccinations
Very nice.
in that room. Also, our delivery now is coming from a back door, so we're not interrupting, customers in the lobby. So we're gonna be on the back door, and also we're doubling our cold storage. So we're gonna have double our capacity
That's great.
on those medications. So
Yeah. And then just to add on to that, health information is coming back downstairs. We moved to the second floor
Okay.
to help patients, so I think most of our patients are being navigated to that second floor. We'll come back down and share the lobby with pharmacy.
Perfect.
So
Now, with electronic records, do you need less space? Are we paperless yet?
oh yeah, we've been paperless. I was thinking about this the other day. It's like almost 18 years we've been on an
Really?
EMR system.
Wow.
Yes.
Oh, wow.
So it's been a while. So I've been around a long time. So we've had paper records for a while, and now being on the EMR, it's exciting.
There are some
to see
places
that.
that still have only paper records, I think.
I don't know. It could be. We're not. It's been fun.
Yeah, you guys are
Fun, fun.
ahead of the game for sure.
Information is just the data that we can get out of those EMR systems is awesome.
Remember during COVID, the vaccination had to be kept at a certain temperature?
I don't.
Yeah,
Oh yeah, like
remember-
on the delivery.
Yeah. So do you
Refrigerated.
have, like different temperature, like courts? Do you have a walk-in?
Well, when we give vaccinations, either they come, if it's a vaccination given in the pharmacy, they come to the lobby, they fill up paperwork, and then we grab the medication, the vaccination from the fridge, and then you have
Okay.
like a certain amount of time to give the vaccination.
So you have a refrigerator.
Yeah.
refrigerator.
Yeah, we're doubling up our capacity right now.
Awesome.
Yeah.
And it's not just vaccinations. There's other medications that have to keep
Correct.
refrigerated.
Yep, that's correct.
Oh, Andy doesn't understand the role of a pharmacy because he's young.
That's not true.
He's young and he doesn't have.
That's not true.
He doesn't have.
But thank
the,
you for saying I'm young. I do have prescriptions.
You have prescriptions?
Yeah, not as many as you. You have one of those Monday through Sunday deals.
I
don't you?
do. I have two of those.
Do you?
Do you have those things?
We
Can you-
do.
can you buy those
And
there?
if you need an expert counsel from any of my people, we're there to help. We have 6 pharmacies working every day. We have 12 technicians.
Wow.
So anytime that anyone needs a personal interaction with the pharmacist, please come to our pharmacy. And now we have a bigger space and a private area where we can
That's
do
great.
consultations.
Thank you.
Yeah.
Anyone wants to use the pharmacy, they can. And if they have questions, all they have to do is call you guys at 517-748-5500 or visit centerforfamilyhealth.org. Great to have you here. Thanks for coming in.
Thank you
Yeah,
for
thank
hosting
you.
us.
Thank you.
Appreciate
Thank
it.
you. Thank you.
Yeah, from the Center for Family Health, Raphael Chavez and Michelle Caryl. More of the morning show after this.